If you are over 60 and you take medication for high blood pressure every day, I want you to stop for a moment and think about how you take that pill. Do you take it automatically, without checking how your body feels? Do you sometimes take it at a different time? Have you ever forgotten a dose and then wondered whether you should take 2 pills to catch up? And what happens when you are sick, dehydrated, eating less than usual, or taking a new medication? These questions may sound simple, but after 60, the way you take your blood pressure medication can affect much more than the number on your monitor. Under certain conditions, your blood pressure may fall more than expected when you stand up. You may feel lightheaded. Your legs may suddenly feel weak. Your vision may darken for a few seconds. And one ordinary trip from your bed to the bathroom can turn into a dangerous fall. But I want to make something very clear right now. This video is not going to tell you to stop your medication. It is not going to tell you to change your dose. And it is not going to claim that every person should take blood pressure medication at the same hour. The truth is more useful than that. The dangerous way to take your medication is on autopilot, without considering changes in your body, your routine, your hydration, your other medications, and the warning signs you may be experiencing. Today, I am going to show you 5 common situations that may increase dizziness and fall risk after 60. You will learn why they happen, which symptoms should never be ignored, and the exact questions you can take to your doctor or pharmacist so your medication plan works with your life, not against it. Stay with me until the end, because the 4th situation often happens in the middle of the night, when the house is dark and no one is nearby. My name is Dr. Samuel Hart, and this channel exists to translate complicated health information into clear, responsible questions that you can discuss with your own healthcare professionals. Before we continue, tell me in the comments, do you normally take your blood pressure medication in the morning or in the evening? Just write morning or evening. Your answer may help someone else realize that they are not the only person trying to understand this. Now, let us begin with what happens inside your body when you stand up. When you are sitting or lying down, blood is distributed throughout your body in one pattern. The moment you stand, gravity pulls some of that blood toward your legs and lower abdomen. Your body normally reacts immediately. Your blood vessels tighten. Your heart adjusts. And enough blood continues reaching your brain. Most of the time, this happens so smoothly that you never notice it. But as we age, this automatic response may become slower or less efficient. Now add a medication that relaxes your blood vessels, slows your heart rate, removes extra fluid, or affects the systems that regulate blood pressure. The medication may be doing exactly what it was prescribed to do. But under the wrong circumstances, your body may not compensate quickly enough when you stand. For a few seconds, less blood may reach your brain. That can produce the familiar feeling of lightheadedness, unsteadiness, blurred or darkened vision, weakness, or the feeling that you need to grab a wall or piece of furniture. Healthcare professionals often call this postural or orthostatic hypotension. In simple language, it means that your blood pressure drops when your position changes. And this is where the first dangerous habit begins. Situation number 1. Changing the time of your medication without discussing it with your doctor or pharmacist. For years, many people were told that blood pressure medication should always be taken in the morning. Later, other people heard that taking it at bedtime was better for the heart. This created enormous confusion. So what does the best research actually tell us? For most people taking standard once-daily blood pressure medication, there does not appear to be one universally superior time. Morning is not automatically safer for everyone, and bedtime is not automatically better for everyone. The most appropriate time depends on the specific medication, your other prescriptions, your daily routine, your sleep, your symptoms, and the instructions from the professional managing your treatment. This matters because blood pressure medications do not all work in the same way. A water pill may increase urination. Taking it too close to bedtime may cause some people to get out of bed several times during the night. Another medication may make a person feel more lightheaded during the first hours after taking it. A person who becomes dizzy after an evening dose may be at greater risk when walking through a dark hallway to use the bathroom. But another person may tolerate that same schedule perfectly well. The mistake is not necessarily morning or evening. The mistake is changing the schedule based on a video, a friend, or a headline without first checking whether the change fits your medication and your body. Imagine this common situation. A person takes a water pill every morning. They hear that blood pressure pills work better at night, so they move every medication to bedtime without asking anyone. That night, they wake several times to urinate. They stand up quickly. They feel unsteady. And the combination of darkness, urgency, fatigue, and a sudden blood pressure change creates the perfect environment for a fall. The lesson is simple. Do not ask only, what is the best time to take blood pressure medication? Ask a better question. What is the best time for this specific medication, considering my symptoms, my sleep, and everything else I take? If you want to discuss a schedule change, bring these details to your next appointment. What time you currently take the medication, when dizziness occurs, whether you wake during the night, whether you have fallen or nearly fallen, and what your blood pressure readings look like at different times of day. That information is far more valuable than guessing. Situation number 2. Trying to compensate for a missed dose. You look at your pill organizer and realize yesterday's tablet is still there. Immediately, you may think, I missed one, so I need to take an extra pill today. That sounds logical, but with many blood pressure medications, taking 2 doses too close together can cause the medication's effect to become stronger than intended. Your blood pressure may fall too low. Your heart rate may change, or you may become weak, sleepy, dizzy, or unsteady. The correct response to a missed dose depends on the exact medication and how much time has passed. That is why you should follow the instructions on your prescription label or patient information leaflet. You can also call your pharmacist. What you should not do is invent your own correction. Do not double a dose unless a qualified professional has specifically instructed you to do that for your particular medication. And remember, more is not better. Blood pressure. Treatment is not like filling a container that became half empty. Medication levels rise, fall, and interact with your body's systems over time. 2 tablets taken close together are not always the same as 2 properly spaced doses. There is another important part of this situation. Some people become worried after forgetting a pill and repeatedly check their blood pressure. They see a higher number. They become anxious. And then they take extra medication in an attempt to force the number down quickly. That can create a second problem. Blood pressure naturally changes throughout the day. It may rise temporarily because of stress, pain, activity, caffeine, a full bladder, or the anxiety of seeing a high reading. One isolated number does not automatically tell you to change your dose. If your healthcare professional has given you a specific action plan for certain readings, follow that plan. Without such a plan, do not chase individual numbers by taking extra pills. Sit quietly. Repeat the measurement according to the instructions for your monitor. Write down the result. And contact your healthcare team if the reading is repeatedly outside the range they gave you. If the reading is extremely high and you also have severe symptoms such as chest pain, difficulty breathing, sudden weakness, confusion, a severe unusual headache, or changes in vision. Seek urgent medical assistance. Situation number 3. Taking your medication on an ordinary schedule when your body is no longer in ordinary conditions. This situation is especially important during vomiting, diarrhea, fever, heavy sweating, very hot weather, or any illness that prevents you from eating and drinking normally. Your body depends on fluid circulating through your blood vessels. When you become dehydrated, the amount of circulating fluid may decrease. Now imagine taking the same dose of a medication that lowers blood pressure or removes additional fluid. A dose that was appropriate for your well-hydrated body may affect you differently when you are sick and dehydrated. You may feel weak, your blood pressure may fall, and certain medications may place additional stress on your kidneys during a dehydrating illness. But please listen carefully. This does not mean that everyone should stop their medication whenever they feel unwell. Different medications require different instructions. Some people should continue treatment. Some may need temporary adjustments, and others have medical conditions, including heart failure, in which changing medication without guidance could be dangerous. What you need is a personal sick day plan. Ask your doctor or pharmacist this exact question. If I develop vomiting, diarrhea, fever, or cannot drink normally, what should I do with each of my medications? Do not wait until you are already sick, weak, and confused. Ask while you are well. Write the instructions down. Keep them near your medication list, and make sure a family member or caregiver knows where they are. This is one of the simplest ways to remove uncertainty during an illness. You should also pay attention during hot weather. After 60, thirst may not always be a reliable warning. You may lose fluid through sweating without feeling extremely thirsty. If you take a water pill or other blood pressure medication, unusual weakness or dizziness during a hot day deserves attention. Do not force enormous amounts of water if a doctor has placed you on a fluid restriction. But do not ignore signs of dehydration either. The correct amount of fluid depends on your heart, kidneys, medications, and medical history. Once again, the safest plan is personalized. Situation number 4. Combining your blood pressure medication with other things that can make you dizzy or unsteady. Many people think only about prescription medications, but your body does not separate products into neat categories. It responds to everything you take. That includes prescription drugs, over-the-counter sleep products, allergy medication, pain relievers, herbal products, supplements, and alcohol. Some products can cause sleepiness. Others may lower blood pressure. Some affect balance or reaction time, and certain combinations may amplify one another. This becomes especially important when a new medication is added. Imagine that you have taken the same blood pressure pill for 5 years without a problem. Then you begin using a nighttime sleep product. A few days later, you feel unsteady when getting out of bed. It may be tempting to blame your age, but the timing of the new symptom matters. Whenever dizziness, weakness, sleepiness, or balance problems begin, ask yourself, what changed? Did I start a new prescription? Did I begin using an over-the-counter product? Did the dose of something change? Did I start taking the medicines at a different time? Am I eating or drinking less? Have I recently lost weight? Have I been ill? These details can help your doctor or pharmacist find the real cause. Keep one complete medication list. Do not list only prescriptions. Include vitamins, minerals, sleep aids, pain relievers, allergy products, herbal products, eye drops, and anything else you use regularly. Bring that list to every appointment. You can also ask your pharmacist for a complete medication review. The goal is not to remove every medication. The goal is to make sure each medication is still needed, is being taken correctly, and is not creating unnecessary risk when combined with the others. Now let us return to the middle of the night, because this is when several risks can come together. You are deeply asleep. The room is dark. Your bladder wakes you. You sit up quickly, stand immediately, and begin walking before your body has fully adjusted. If your blood pressure drops when you stand, you may have only a few seconds of warning, so build a safer nighttime sequence. First, sit on the edge of the bed. Move your feet and ankles gently. Take a slow breath. Notice whether you feel lightheaded. Then stand while holding something stable. Pause again before walking. Keep the path to the bathroom clear. Use a nightlight. Do not leave loose rugs, cables, shoes, or small furniture in the walkway. And do not use unstable objects, such as a rolling chair, for support. These steps may sound almost too simple, but independence is often protected by small decisions made before an emergency occurs. Situation number 5. Ignoring dizziness because you assume it is normal aging. Dizziness is not a diagnosis. It is a message. Sometimes the cause is relatively simple. Standing too quickly, not drinking enough, missing a meal, or adjusting to a new medication. But dizziness may also be connected to an abnormal heart rhythm, blood loss, infection, inner ear problems, low blood sugar, or other medical conditions. That is why repeated symptoms should not be dismissed. Pay special attention if dizziness begins after any of the following: starting a new medication, increasing a dose, changing the time of a dose, losing weight, becoming ill, experiencing vomiting or diarrhea, or adding another product that causes sleepiness. Also notice the pattern. Does it happen immediately after standing? Does it occur after meals? Does it happen only in the morning? Does it appear within a few hours of taking your medication? Does it happen while you are sitting still? Does your heart feel unusually fast, slow, or irregular? Do you feel as though the room is spinning, or as though you are about to faint? These differences matter. Write down when the symptom occurs and what you are doing. You do not need a complicated journal. Use 4 short lines. The time. Your blood pressure, if you can measure it safely. What medications you recently took. And what you felt. Bring this information to your appointment. It gives your healthcare team a much clearer picture than simply saying, "I feel dizzy sometimes." There are also warning signs that should not. Wait for a routine appointment. Seek urgent help if dizziness comes with fainting, chest pain, serious difficulty breathing, a sudden severe headache, new confusion, trouble speaking, sudden weakness or numbness on one side, or an inability to stand safely. If you fall and hit your head, especially if you take a blood thinner, seek medical guidance even when you initially feel fine. And if a medication causes swelling of the lips, tongue, face, or throat, or makes breathing or swallowing difficult, treat that as an emergency. Now, let us put everything together into one simple routine. Number 1. Take your medication according to the schedule provided for you. Do not move it from morning to evening or from evening to morning simply because someone online said one time was better. Number 2. If you miss a dose, check the medication instructions or call your pharmacist. Do not automatically double the next dose. Number 3. Create a sick day plan before you become sick. Ask what to do during vomiting, diarrhea, fever, dehydration, or an inability to eat and drink normally. Number 4. Keep a complete list of everything you take. Review the list whenever a new symptom or new medication appears. Number 5. Treat repeated dizziness, weakness, and near falls as information worth discussing. Do not dismiss them as an unavoidable part of age. And number 6. Make standing safer. Rise in stages. Use stable support. Illuminate the path and remove hazards from your home. Here are 5 questions you can write down and bring to your next appointment. Is my current blood pressure target appropriate for my age and health? Could any of my medications be contributing to dizziness or balance problems? What should I do if I miss a wee dose? What is my personal plan during vomiting, diarrhea, fever, or dehydration? And should the timing of any of my medications change because of my symptoms or sleep routine? Those 5 questions can turn a confusing prescription routine into a real safety plan. Your blood pressure medication is not the enemy. When prescribed appropriately and taken correctly, it can protect your heart, brain, blood vessels, and kidneys. The goal is not to become afraid of your medication. The goal is to understand it. You deserve to know why you take each pill, when you should take it, what side effects deserve attention, and what to do when your health or routine changes. Because protecting your blood pressure should never mean sacrificing your balance, your confidence, or your independence. If this video helped you, share it with someone who takes blood pressure medication. They may have followed the same routine for years without ever receiving a clear explanation of what to do when they miss a dose, become dehydrated, or begin feeling dizzy. And before you leave, write morning or evening in the comments. Then add whether you have ever felt lightheaded after standing. Your experience may help guide a future video. Remember, never stop, double, or change the timing of a prescription medication without guidance from your doctor or pharmacist. This video is educational and is not a personal diagnosis or treatment plan. Your body changes. Your routine changes. And sometimes your medication plan needs to be reviewed as well. You are not asking too many questions. You are taking an active role in protecting your health. And that is one of the strongest things you can do at any age. I am Dr. Samuel Hart. Take care of your heart, protect your balance, and keep building a life that allows you to move with confidence. I will see you in the next video.